Hello everyone, I'm Buşra Nur Özger. Today, I'll be answering whether skin sagging surgery can be performed in a public hospital. I'll be answering this question. Since I am a patient myself and also work in this field, I receive many questions about this topic from various places. Because, as you know, the financial costs in the field of plastic surgery can be extremely high. You can find options that are very affordable, and you can also find ones that are extremely expensive. And it's also possible to find places where the procedure can be done for free. If you ask whether these procedures can be done in a public hospital in Turkey, I personally had my procedures done years ago at a training and research hospital. There were many different reasons for this. Because at the time when I had my surgery, unfortunately, this topic was not being discussed. There wasn't a patient profile like mine on social media, and I will touch on this topic again. We are postpartum bariatric individuals. In other words, we do not go through the standard aesthetic surgery processes. Unfortunately, our incisions, procedures, tissue deformations, and skin quality are not at the level of a mommy makeover. So, even though I had more knowledge than many patients at that time, unfortunately, I did not go through my surgery processes in the right way or at the right point. Later on, with the business I established, I actually learned exactly how things should be done, under what conditions, and which type of surgery should be performed. Nowadays, when you ask whether this surgery can be performed in a public hospital, the concept of the hospital you go to, its operating room, the surgical staff, and the team working there are all very important. Since experience is crucial in these matters, you really need to know every detail very well, from the hospital you will go to the team there. I can't make a very strong statement about this topic. Because, as I said, I myself had surgery at a training and research hospital. I had surgery under the wrong conditions and in the wrong ways. Currently, I provide private services on these matters. But I can never say that you should never have surgery at a public hospital or that you must have surgery at a private hospital. Because many doctors already have experience working in public hospitals in their backgrounds. Here, you need to make your decision by evaluating their experience and expertise. You need to make your decision by looking at their references. I still can't give you a definite answer about this, but you can write in the comments any questions you have or share your experiences with public or private hospitals during these processes. On this topic, both as a patient and as someone who provides services in this field, I would like to talk and chat with you in detail. I hope my video has been helpful. Let's meet in the comments.